So here we have got a scan of a patient who is 25 years old and who had been complaining of right-sided lower backache since last 2 weeks. He had been having some fever, however, not it wasn't that high. So the based on the clinical examinations, the clinician had ordered for an MRI of hip in this patient. So the striking finding that we are seeing, this is a coronal stir image and this is a coronal T1 image. The striking finding that we see here is a unilateral edema in the right iliac wing. So this is the iliac wing. It is along the posterior aspect of the iliac wing. So this is the edema, and on T1 weighted images it becomes hypointense significantly. So this part of the iliac wing which is involved is seen adjacent to the right sided sacroiliac joint. So whenever such finding is there of edema in a young patient who has had some vague complaints and has come, the first thing that we can think of would be an infective pathology. As it is adjacent to the sacroiliac joint, the first thing that we need to see is how the joint is, whether it is involved or not. Here we see some amount of joint edema, joint effusion compared to the opposite side. It is a very good thing that we can compare both the joints together. Here we are discretely seeing this edema on the right side. There is subtle edema in the fibrous aspect of the joint as well. So the entire joint, the synovial portion as well as the fibrotic portion has been involved. There is subtle soft tissue edema on the interior aspect of the joint, the periarticular aspect. So subtle edema is there. As we go inferiorly, we are able to see some amount of edema in the aspect, the sacral aspect of the right SI joint. So this is not that well appreciated. However, compared to the opposite side, the sacrum, there is certain edema. So the first thing that comes to mind while thinking of such patients is an infective kind of thing. It can be, most of the time it turns out to be a staphylococcus infection. However, the infection of some granulomatous etiology like tuberculosis or like brucellosis or fungal infection, it can also occur. So the main hallmark of infective involvement of the sacroiliac joint is unilateral involvement, subtle edema, subtle involvement. In this case, the patient had come earlier to us, so we are able to see the involvement on the unilateral aspect rather than both the side involvement. However, this type of infections come usually late, so we are not based on the type of symptoms, usually the patient would ignore it and would come later on, but this is a good catch clinically as well, as the patient had come earlier. So one more thing that we need to see is the sciatic nerve, which is coursing just here up somewhere in the sciatic foramen as it exits outside. So we should know whether there is any involvement, any neural edema. We should compare it with the opposite side. So we should also see if it is tuberculous, likely it would be involving the spine, spondylodiscitis, psoas abscess. So all these things should be borne in mind while doing that. And if a similar patient, as this patient was young, the first thing that came to our mind was infective thing. But if similar patient comes say around 65 years of age, we would think of metastatic etiology or neoplasm. But the involvement of the joint makes it more likely that this is an infective etiology. However, the periarticular edema is not that much. So we can think that maybe it is some kind of organism which is slow growing. That's why the edema is less. So this is a typical case of infective sacroiliitis. Thank you.